of time, I would move on to the last talk of the session by my good friend Dr. Mohit. Sir is an assistant professor in the eye department at Advanced Eye Center, PGI Chandigarh, and sir would be talking on Coats disease with epiretinal membrane, one of the spectrum that we haven't covered in the pediatric vascular diseases.
Thanks, Simar.
This is my last case. Actually, I've gone aggressive. I have not seen any change in the results, so I will not recommend ILM peeling in these patients. Just do trim the stalk till the edge and remove the hyaloid deposit.
And lens management, sir, would you recommend combining it with the cataract surgery or doing a lensectomy? Or
of course, if eye has a potential, if the macula is no stretched up, is not less, it all depends how much is the macular, the foveal stretch is there.
Yes.
So if the stretch is not enough, is not great, so you can put an IOL there. But these things can be done later on also. You can always put them, give them contact lens or plan TSFR later in the life.
Yes. Right. Thank you. Subhadra ma'am, if you have any experience with...
We call the pediatric cataract surgeon, and if the corneal diameter is more than 10.5 and the capsule rim is good, they put the IOL same time. But if the corneal diameter is smaller, then they don't put. Then they don't wear contact lens as much. They have a esotropic eye, so really you don't have too much of good outcomes with that. So if the corneal diameter is good and capsule rim
I think
is
both
there.
this and as well as Coats disease are a problem, ma'am, because they're mostly unilateral and...
Yeah. But I haven't done so much dissection. Most of my PHPV cases, if the stalk is there, I just cut it
just
and
dissect it
let
and
it fall. Anyway, you
back.
can't open that retina, and it's a dysplastic retina. But important thing is to identify where the stalk ends and the retina starts, and cut at the stalk, not at the retina. So it could be right at the disc, it could be up, it could be up. So that's it.
Right. Working?
Saw nearly about 91 cases that we analyzed. So it is an interior and posterior presentation. So the interior presentation would largely be just this stalk. So all you need to do is, as ma'am said, if you have a pediatric cataract surgeon who could do it, and you just cauterize the stalk and trim it and leave it. But some of the posterior ones are really bad, which has microphthalmia, which have the interior proliferation, which I think Dr. Sengul Losdick has recently come up with a paper with the anterior elongation of ciliary processes and tenting, and they behave like almost like a stage 5 disease. And then you have to go through limbus, remove the lens, and see if you can salvage any useful vision. So the spectrum of the disease is quite varied.